Hi, I'm Dr. Paulina Villa and I'm the Medical Director of Medical Air Service.
Join Dr. Paulina Villa as she breaks down the essentials of medical transport in the U.S.
So the first thing that they need to know is that we exist. That the work we do is something really common, but usually people don't know about this until they need it.
What advice do you have for families who have to make quick decisions about medical transport?
The first thing that they need is to get on a phone with either us and see what they are looking for. If it's an air ambulance service, if it's a medical escort, see what's the suitable transportation for the patient and what they need. Usually what we do is we give an assessment with what they give us until we are able to speak to either the treating physician or we're able to get a full medical report or just the basics.
When does a patient truly need an air ambulance for their medical flight, and what alternatives exist if cost is a concern?
That depends on a lot of things. Basically, the first that matters to me is what does the patient need. So if the patient is receiving ICU care, it's out of the question. Everything is out of the question. You need an air ambulance because the air ambulance is equipped as an intensive care unit, but with wings. So a commercial stretcher will be the second best option when people cannot afford an air ambulance and the patient needs to be laying down. There's other solutions. It really depends patient to patient and it varies whether the patient has to be laying flat all the time or if they can be seated up for takeoff and for landing.
What questions need to be answered to decide if a patient is suitable for a transport with a medical escort?
If the patient is in a more basic care setting, let's say a nursing home, maybe intermediate care, then we have to ask questions like the basics on about oxygen. Can he sit down? Does he need assistance to walk? Then we can determine if he is qualified to be taken by a medical escort.
What is usually the first step in organizing a medical flight?
Usually, either the family or the patient give us a call and we're able to set up everything for them. We just have to assess what they need. We can either fly them in air ambulance or we can do medical escorts.
What is the difference between international medical transport and domestic transport?
International medical travel is a little bit more complex, not because of the documentation, but because we have to get a lot of people involved. So coordination people, the coordination department, all the doctors that are going to be involved and the people that are going to be in contact with the patient. Talking about documentation, the most important thing is a full medical report if it's available. If not, we can sort it out. Also, passport.
What happens if a patient doesn't have their passport during international medical transport?
So usually, if the patient does not have a passport on them, if they have a copy of it, if they have a photograph of it, we can start working our way with that and we'll see. There's a lot of embassies and consulates all over the world that can help get an emergency passport in case you don't have it, you lost it, or it's just not in hand and it's needed.
Does health insurance cover a medical flight?
If you have an insurance, reach out to us and we can sort it out. Even if you don't have insurance, you can reach out to us because we also do work privately. We're going to try to figure out what's the best option for you, but if you have any questions, just call us.
Start your safe medical transfer today with our experienced team.
Whether arranging care in the US or internationally, proper medical coordination ensures a safe transfer. The good thing is that our coordinators already know this procedure, so you can just reach out and we'll sort it out with you. Every case is very different, but the good thing is that we solve them all.